going to transition now to our case presentation. And Shawnee Christian Healthcare has our first case for us. So I'd like to introduce Celine Mutuyamaria. Was I close, Celine?
Close.
I think I've been practicing. You have a very lovely last name. I've been practicing. So we will turn it over to you to go through our case, and then we'll have some discussion about it.
Okay, great. So I'm going to be presenting a case about a client I have been working with since about April of 2018. This client is 58 years old, she's female, and right now her housing status is that she was in public housing when we first started working together, but then had to move out of public housing, which I'll get into a little bit towards the end of the presentation. And I've listed some of the relevant medical conditions and list of her medications, behavioral health diagnoses, and medications that she's had in the past, which the two that I've listed are not active at this time. And she reported to me that she smokes at the most a pack a day, but on average, maybe 3 cigarettes a day, especially because at this point, she's been trying to work towards smoking cessation. We have provided, I've provided face-to-face counseling, informal counseling, and I've also provided a referral to the quit line for her more recently. So I'll kind of just get into the basic background information. So I've been working with this client and her partner, her partner since April of 2018, just coordinating care and helping them to manage some of their complex medical conditions. She was prescribed Wellbutrin around January of 2018 by one of our providers, and she stopped taking this medication because she was having some side effects which she attributed to the medication. Later, she found out that she had a hernia and later received treatment for this, but with everything else that was going on medically, I don't think that she kind of re-engaged in a discussion with her provider about smoking cessation. Some other things were prioritized after that. So she had quit smoking in the past and started smoking again around the end of 2017 when her partner's health severely declined, and she is the primary caretaker for her and her partner, and both of them have very little support in managing their complex medical needs. Her partner has also been advised to quit smoking by his oncologist, but he's having a lot of trouble with motivation around this. And about May 2018, I looked at her chart, and she did talk to her provider about trying to quit smoking again, but since then she's been seeing different providers. So I think that conversation has kind of got lost in figuring out a bunch of the other medical conditions that need to be coordinated. More recently, I gave her some smoking cessation literature on the 16th of January, and I offered her some support in calling the quit line when I did my home visit on that day, but she didn't feel comfortable calling the quit line at her house. She felt like there were too many distractions, so she asked if she could come into the office at another time to call the quit line, and so we're working to coordinate that. She wasn't initially, she was a little apprehensive about the quit line at first because she says she thinks she'll do better with in-person support, like maybe an AA type of group, but for smoking cessation. So I told her that the quit line and the coach might possibly have some referrals or some community resources that maybe we could look into. And so she was encouraged then to make that contact and at least try the quit line. And so a lot of our work moving forward will be about making sure that she has the resources she needs. So from a cell phone, which she doesn't have right now, a working cell phone and enough minutes on her cell phone and a space where she knows she can talk to the quit line when needed. Working with her to try to find stable housing. She left public housing because her husband became very ill at the end of 2017, and the hospital charged my client with his care. At the time they were separated, but when he became ill, he moved in with her to this public housing apartment. And later on in 2018, her property managers found out that there was somebody living there that wasn't originally on the lease, and she became very anxious about this situation and kind of abruptly decided to just leave there and go with family rather than trying to figure out that situation. And so she's living with family right now, and we're trying to find her and her partner stable housing to move into. Another complicated part of this is that she's being considered for a kidney transplant, and she went in for a consult to begin that conversation. She was told that her nicotine level has to be 0 in order to move forward, and right now she's on a 6-month waiting period so that we can evaluate her ability to stop smoking. And so she got labs done at her first consultation, and she was told to call them back after she has stopped quitting for 30 days to come back in for repeat labs. I think her biggest barrier, outside of maybe feeling like things are stable in terms of housing and things like that, her husband is not necessarily super motivated to quit smoking, and she says that with him smoking, it's hard for her to stop. And she really wants to be considered for this kidney transplant, but she's really open at this point to any resource that can help her and her husband, hopefully, as well. So I'm kind of on the call to get any feedback about tips that you all may have. I think outside of calling the quit line, I'm going to try to encourage her to see her provider and try to see if they can explore medications or restart that conversation. But as you can see, there's a lot of complexity to this case, and any feedback that you all have would be very helpful in moving forward. I tried to summarize that. I didn't go according to each box as much, but.
That's great. That's great, Celine. Thanks so much. That's a great case. I think, just to summarize briefly, this is a 58-year-old patient that Celine sounds like a really strong relationship with and has been working with for some time now, with several complex medical problems as well as a kind of complex social situation, who has some interest in quitting smoking, but has several barriers to that. So that's my very, very brief recap. But before we move on to really discussing and having our faculty input here, are there any clarifying questions? Anybody else on the line have other questions or want to know more about anything, or anything that you just want to get some clarification on? If you want to speak, just unmute and speak, and we'll just go one by one.
Hi, this is Bob Burns. Could you just clarify her current housing situation?
She is staying with her daughter right now.
Thank you.
Yes.
Great. Let me pause really fast. I'm telling you guys, this is exactly how ECHO is supposed to be. So we're like the case, the clarifying questions, that was perfect. Both Celine and Bob, those are perfect examples of a clarifying question in the case. So just some encouragement that we are on the right track and doing great. Any other clarifying questions? Anything else you want to know about, or things that would help add to the discussion?
So this patient has never.
Is she able to reapply again for public housing, or able to get a Section 8 voucher, or is she going to try to do the quit smoke sessions before she tries to apply for additional housing?
We're working on those simultaneously right now, looking at different housing options, and also trying to get her established with smoking cessation support. So she's we're getting an application. I got an application actually from Heath for the Section 8 program, but also for public housing as well. And so at this point, it's just a matter of time before we complete those and submit them for her consideration. But I think, as everybody knows, that can take a little bit of time with wait lists.
Hi, you had mentioned that she had previously quit, and that also she was previously on behavioral health meds. Do you know if when she quit, she was on those meds? And is there any way we could get her back on her behavioral health meds?
Did you say, is there any way we can get her back on the meds?
Mm-hmm. Yes.
Yes. Yeah, so she quit. It seems like, to me, from what she's described, the tipping point was when her partner became sick. I think that she had removed herself from a lot of maybe, I don't know if you would call them triggers necessarily, but from an environment where she was likely to smoke. She said, you know, she was worried about herself, taking care of herself, and it was easier for her not to smoke during that time. But at the end of 2017, when she gained that responsibility of being her husband's primary caretaker, that's when things kind of went back to her baseline of smoking. So as far as the doctor though, because she's had so many other medical issues, every time she's in our office, a large part of the conversation is surrounding something else, like, you know, kidney care, things like that, and preventative care. So now, only now have we really gotten to the point where a lot of the things that were her priority have been stabilized, and we're really getting into the conversation about smoking cessation. So I am going to encourage her to schedule an appointment this month so that the conversation can be focused on smoking cessation and looking at NRTs and what the provider might recommend.
Okay, other questions from the group?
Celine, could you just kind of maybe articulate what you see right now as the greatest challenges and I guess areas where maybe you have questions about some solutions?
I think right now there's still a good amount of stress in her life. And I think that because of her environment where her daughter smokes and her partner smokes, it seems like she's maybe not in the best space where the people around her are supporting her goal. And on top of that, with her stress, if smoking is her main coping skill, I think that's what she's going to go back to a lot of times. And this makes me think about maybe getting her connected to Amy with behavioral health. That's not been something that we have discussed as much. So maybe that could give her other coping skills so that she has options besides just smoking to cope. But I think I really need a lot of feedback about maybe medications or any type of NRTs that could help the physical cravings, you know, things like that. Whereas I can maybe provide more support with getting her connected to alternative coping skills.
Hey, Celine, it's Jeff Ella. Hey, super quick question, not so much on the medical front, or excuse me, the medication front. My apologies if we covered this already. Any kind of transportation issues that she might have to get the medications or make appointments or anything like that?
That she does pretty well with that. She's
Okay, very good.
driving and has a car, and so
Fabulous.
Yeah.
Fabulous.
Great. Great, thanks everyone. Those are all great questions. Let's shift now and let our faculty get some thoughts on, you know, ideas for Celine. I know, Frank, would you like to go first? And some of the questions were about some medications and things like that.
Sure. So two big things I'd like to cover. Number one, this idea that you can't quit if you live with another smoker. I know it does make it problematic, but there are ways to deal with that. So Celine, this might be something you want to talk to her specifically about. And I can give you like 4 steps here. So first of all, she needs to really inform the other people in the house about why it's important for her to quit. And not just say, you know, you can't smoke around me or make demands, but to do this from a negotiation perspective. And what I've always taught the people I've worked with is, number one, you talk to the smokers about where and when they smoke. So you don't want them smoking around her. You want to assign a room, an area, you know, some place where they're not smoking in front of her, and still let them smoke. So, you know, they're more likely to agree to that. I would strongly suggest, if the weather's okay, that they go outside. If she really explains to them that this is an impediment to getting her transplant, I can't see where they're not going to go along with her. You know, most smokers will go along with somebody when they're wanting to quit if they're given a good reason. So, you know, I can't think of a better reason than that. So negotiate with the other people, determine where and when they can smoke. And another important thing is to give them their own ashtray. And they are to maintain that ashtray once they're done smoking, they're to clean it out and throw the butts away, because the butts can be a trigger in and of themselves. And I know plenty of people who don't have cigarettes who've gone and taken butts out of ashtrays and smoked them.
Yeah.
That can happen. Then
I don't mean to interrupt, but Becky, are there notes for this, or should I be trying to capture the notes myself?
Yeah, we got you covered, Celine. We're taking notes, so we'll send you everything. So you just listen and absorb, and we'll send you the notes. We'll send everybody the notes, actually.
Great.
Yeah,
Thank you so much. This is great.
Yeah.
okay, and then number 3, on her part, once they have done this, and once they've agreed to these things, then I would suggest that she do something to thank them for operating. Cook them a special dinner or something, but after a month or so, come up with some little gift or something like that will act as a reward. It's a nice thing, for her to say thank you. So whatever she wants to do is fine, but I would suggest that. And the third thing that you want to have the smokers do is to hide their cigarettes. They're not to leave anywhere she can see them.
Okay.
It's really about the smokers policing themselves and not doing it in front of her. And again, I think if you present it from this perspective that it has to do with the transplant, that they'll agree to it. And if she's not comfortable doing that by herself, maybe that's something they can come in with her one time they're seeing you, and you can, help them, negotiate all of that.
Gotcha. Okay.
The second part of this is she really needs to understand that they're not going to do this transplant unless she quits.
Right.
They may have said that to her, but she may not really understand that, and she may really think that, that's not going to happen. Now, fortunately for this case, I actually worked with one of the transplant units at University of Pittsburgh as their smoking cessation counselor. So I have plenty of experience with people in this situation. The one thing you want to emphasize with her is that she is being given a gift. And the question then to her is, how do you treat gifts that are given to you? And literally, and again, if you're using motivational kind of interviewing, you want to ask her those kind of questions rather than tell her. Okay. So how do you feel about getting this gift? How would you feel if the gift was destroyed? How, that kind of thing, focusing on the fact that she's being given a second chance, that this is something that is not being offered to every person. And that, the idea is that when you are given a gift, you take care of it. Okay. You really want to get her around to the point where she is telling you that she wants to quit rather than us telling her she has to quit. Because she can tell you anything she wants in those sessions, or tell the doctors, or, she can quit for probably however the length of time is that she has to. But the moment she's out of that hospital, she's going to go back to smoking again. Mm-hmm. So it really is all about helping her change her perspective. Because right now, I'm sure she probably thinks that everything's out of her control. She has no control over her life. Everybody's telling her all this stuff. She's going to die if she doesn't get this transplant. So it's working with her about having her gain control of the situation. And one, if you're comfortable enough, I actually did work with a person who told me they had to quit to get the transplant. And I said, well, no, you don't. And they said, well, yes, I do. And I'm compressing this conversation. I said, no, you don't. You have a choice. Oh, no, I don't. I have to quit. I said, no, you don't. There's a choice. You can either quit, or you can, if you don't, then there's consequences to that. Mm-hmm. What happened with this person when I did it, and obviously I said, I'm compressing this conversation down into 30 seconds, is that he finally realized that he had some control over that. Mm. Okay. Even though we want them to make the choice that they're going to quit so that they can have the transplant, but they really do have a choice. So I think that's another very powerful but important thing to get across to her. And again, I don't know if you're comfortable doing that, or you feel you have the background to do that, but if you don't go in that direction, talking about the gift part of it is very powerful. I found that worked with every single patient I worked with around this question. And then I think a third behavioral thing you can look at is, she did quit, as you mentioned, and other people have asked. So what brought her back to smoking? And the answer I can tell you is that she somehow thought that this was going to help her deal with her husband. So your question to her was, how did it help? What did it really do that made the situation any better? And of course it didn't. But again, you want to ask her those questions so she tells you, well, it didn't make it any better, it made it worse, rather than actually just telling her that.
Okay.
Okay, I know that's a lot, but
no, that's really helpful.
Becky said they're taking notes.
Yeah, especially with the family thing. I didn't really know how to bring them in on this other conversation, but your suggestions make a lot of sense.
Good. And you have my email address, or if you don't, Becky can get it to you. If you need need to ask me specific questions, go ahead and do that. Email me and I'll be happy to respond.
Awesome. Thank you.
That's helpful. Thanks so much, Frank. That's great. Those are some great ideas. And anybody else on the faculty, Amy or Linda or Steve, anything else you'd like to add, or other parts to help Celine with?
Yeah, this is Steve. A couple other things. First of all, I want to thank the presenter for really going the extra mile. I mean, she modeled what a concerned person can do to help someone stop smoking. And I know it was frustrating and you haven't gotten there yet, but boy, I'm impressed that you really did an amazing job. Second, I want to reinforce all that Frank said. Then I'm going to get into some kind of medical stuff. If her kidneys are failed, she's going to have to go under hemodialysis, which is very inconvenient. It means going to the clinic, having to get hooked up to a machine to clean your blood of the toxins that the kidney isn't getting rid of. It takes a lot of time. It's uncomfortable. And the outcomes of dialysis aren't as good as a kidney transplant. The kidney, I'm sorry?
She's getting dialysis now 3 days a week.
Yeah, and so that's a real problem. So getting a transplant, so I would probe, how does she like dialysis? Wouldn't she like to not have to do it? Because that's a benefit from the transplant. The transplant people have made a mistake. They have said, we want you to be free of any nicotine. But in fact, if she's taking NRT, she'll test positive for the nicotine. So tell them that there is something called a carbon monoxide monitor. And that's the thing that they ought to use to clarify that she's smoke-free. Because otherwise, your treatment is going to give them a false positive. So those are the two things that I would urge.
Okay, thank you.
That's great. Thanks, Steve. Helpful. Linda or Amy, I just want to give you a chance to comment if you have anything. No need if you feel good about where we are.
Hi, this is Amy.
Sure. Go ahead, Amy.
I'm just going to give a couple little tips with just practical counseling points. So just some starting points and some of that discussion too. Looking at any smoking patterns. So evaluating her smoking behaviors. You know, why does she smoke? When does she smoke? Where is she? What is she feeling? So you can kind of get those starting points too, so she can kind of identify those kind of triggers and those different situations that can help her put together a plan to cope with those things.
Okay.
Also, many smokers are smoking to either cope with stress, to help them relax, or also to focus. So discussing those 3 different topic points, seeing if her smoking is correlated with any of those things, and then looking at different ways to cope with those stressors or helping her relax, finding other ways to deal with those sorts of things, just kind of good practical counseling points there. And then lastly, to talk about cravings and urges as well, so that, you know, when she's trying to quit, she has those urges. They typically last 2 to 3 minutes. So to have her be aware of that, and different ways to deal with those urges, a distraction technique. So you can go through all of those different benefits in quitting so that she's able to get that kidney transplant, her health will be better, that sort of thing. And then also she can focus on the urge and take control of it. That's another tactic to use. So knowing that urges are just that body's way of dealing with withdrawal, that she has control of it and she can be in control and know what to do with that. So she doesn't have to get into that urge. She's going to choose not to deal with that and smoke, but kind of wait that out. And then also leaving that situation. So when she's having that urge to go do something else, kind of also a distraction. So go make a meal, go take a walk, that sort of thing to get your mind off of it. So when she can kind of identify that, is aware of how long those urges can last, it's easier to then develop different strategies and kind of identify ways that she's going to deal with those. So just kind of little practical counseling points there.
Awesome, thank you.
Hi, and this is Linda. Celine, thank you so much for presenting that case. It was really so helpful to hear a lot of background information about her life and what's happening with her husband and her loss of her own residence. But I would also just thank Frank for really getting us started and his excellent comments, really talking about how you can help this woman move from thinking about quitting to really taking some action, you know, to moving from a contemplation stage and to, you know, taking action and being ready to quit. And so glad Steve jumped in with the comments about her condition and the use of NRT, because I was wondering about that myself. So thanks, Steve. And Amy's really emphasis about understanding her smoking history and what we can do to help her along the way, you know, stay smoke-free. I wanted just to add in that, you know, whether she talks to a quit line or a community-based tobacco treatment specialist, that they can very systematically walk through her smoking history, you know, her former quit attempts and what those were like, how she succeeded, how maybe she, what didn't work for her. And as Amy mentioned, you know, why she started smoking again, ways to get her back on track. But it's really going to be important for this woman to get, I think, as intensive tobacco treatment as possible. It's, you know, critical to her health and getting her that transplant for her to be smoke-free. And so I just wanted to suggest that even if she is willing to call a quit line with you or to, you know, go to a community face-to-face tobacco treatment specialist, it's going to be really important for her also to use full course medication, whether it's NRT or something that's prescription. And that's something that her provider can give to her. And hopefully if she's on Medicaid or some other kind of assistance, that can be covered with, you know, no out-of-pocket cost. And I just wanted to emphasize for you, and I'd be interested in hearing, especially Steve as a medical practitioner or Laura's comments here. I think it's really, really important to talk to her about, you know, getting intensive treatment. The quit line can provide her probably with 2 weeks of NRT, but I think this woman, it needs more, and it's going to be really important to maybe have her provider start her off with a prescription, advice to quit, and then to make sure that she plugs into somebody who can help her with the counseling, who can be talking with her over her, you know, the period it's going to take her to think about quitting. But you know, you've provided really important background for us to understand this woman's life and how important it is for her to quit smoking. So I just wanted to add those things back in.
Thank you, I appreciate it.
That's great, thanks, Linda. Yeah, I agree, that's great. All of it was really like a nice comprehensive approach. And Celine, you know, talking with her provider, it sounds like she's bounced around a little bit, but maybe there's a way for you to connect with somebody either before she has the next visit or do the visit together to like just talk about the importance of tobacco cessation and getting her the most intensive treatment you can. That's great. So this is a great case. We're gonna, for sake of time, I'm gonna wrap this up. But a couple things are gonna happen now. So we will capture all the notes and send those out to the group actually, because I'm guessing, you also can shake your head if you agree with me, but I'm guessing that many parts of this case are transferable to other patients that you all see in other circumstances that you find your residents or patients in. So everybody will have access to that. And then Celine, feel free to bring this case back to us, you know, in a month or two, or whenever you need, you know, sort of the next layer of help as you work with your patient. that'd be fun to follow up and sort of see how she's doing and what's working, and then address any kind of new challenges and barriers that may come up.
Okay, thank you.
So, yeah, thanks so much. And now we're going to transition into our update about the collaborative action plans. So the first state we have on the list is California. So Humberto, I hope I said your name correctly. You're on, and you can be brief. I know we're just getting started, but just a brief update, and then we can have a little time for discussion and wrap up our time together.
All right, thank you so much. So it's not that brief. We've actually been doing a lot of work these last couple of weeks since we got back from Atlanta. So plenty of meetings. We've had meetings with Sharon Cummins down in San Diego to plan a walkthrough of the quitline process so that we know it from the user side of that. So we know exactly what our patients and our participants will know to expect when they call the quitline. We've also talked about the direct referral process. So that was the process of us getting the information to the quitline so they can call them directly back, and the participants don't actually have to call, they'll just wait for a call. Third, we did get a breakdown of the quitline access by zip code, which actually showed that not a lot of people in our zip code or the two adjacent zip codes next to us actually used the quitline a lot, which actually kind of gives us a good opportunity to increase the usage of quitline with this program. She also got us information about the Asian smokers quitline, which in our population here in San Francisco, we have large populations of Asian people who smoke. So that's definitely going to be a big help to us. We've had meetings with Jamie Adler, our good friend over at ACS in Alameda. And we have definitely discussed a lot of the grant outcome measures, definitely trying to work those out to kind of figure out, how we can help the most people. Second, we've talked a lot about the general program design. And we've been making some ongoing adjustments to our global aim statement and our collaborative action plan, just to make sure that we're pinpointing the population that we are looking to engage in our program. We've also had meetings internally here with our behavioral health supervisor, as we are connected to a Department of Public Health clinic next door to us. And we have basically worked out a way to make sure that referrals go from us to them and from them back to us, so that we all have a chance to get an intervention into these people, i.e. increasing their chances of a quit attempt. We have also engaged our pharmacist next door, and she is going to give us the lowdown on NRTs, on medications used to help people quit smoking, costs here in California, side effects, reasons why people like them or dislike them, and which work best for her patients in our clinic. And then lastly, we met with our internal program developer and research to discuss our reporting and our collecting of demographics and kind of like what our surveys are going to look like going into the programs. And then we're going to get now into program planning. So we've got lots of things kind of in the on the stove in different pots. Yeah. First of all, we are planning a health fair April 5th. That's going to be in collaboration with our primary care clinic, including with using our pharmacist that day. We are going to actually, our goal is to do outreach for a smoking cessation program at that health fair. Also, we are doing our intervention planning. We're in the research and development stages of our intervention right now. We have a basic overview of our class plan, its contents, and where we would like to do these interventions. We have definitely signed up for resources at the SCLC, as well as the TECC for posters, resources, all that good stuff.
curriculum.
Yep, and then Becky over at ACS has also
graciously agreed to send us lots of good materials and marketing stuff. So
absolutely,
thank you.
yes, thank you, Becky.
Our pleasure.
And
Thank you for using them.
Yes, of course. And we're also doing a lot of recruiting and outreach right now. The best part of working here is I share a space with all of our social workers who work with a lot of people who smoke and who are looking for smoking cessation services. So we've definitely started recruiting. We have a list going on. We started that in January, and that will be ongoing. We do have a list already of some people who are like gung-ho. We have some residents who live upstairs, one of them who asks me basically every time she sees me when this program is starting. So we're definitely excited to start this, and we're looking to start in March. So in 1 month, we're basically going to be rolling this out. And then the last thing we've worked on are basically our surveys and assessments. So working on the design of the baseline and follow-up surveys and what our process is going to be. And it looks like right now we'll be looking at baseline 1 month and 3 month survey updates. And then we are working with Jamie over at ACS on tracking non-clinic patient smoking data, seeing as we're only connected to the patients who come to our clinic, but we will be doing this in the community.
Citywide.
Yeah, citywide. So we're kind of working out the details on how to get that kind of data to kind of go along with what data we're going to collect at our own clinic. And other than that, we're just still working, learning definitely. Yeah. And trying to get some of these kinks out so that we can go live basically next month.
That's great. Thanks so much. You all have been busy. So that's great. Thanks for all the updates. This sounds like you're making great progress. So we look forward to being here together with you.